And I'm fascinated in this area of work because, you think back and it leads me into an area where you're an expert, and that's palliative care. And it seems like, there are many people who, when first diagnosed, they're with their medical team. And, really when I think about a diagnosis, especially of cancer, I think there's the medical aspect, there's the emotional aspect, there's the spiritual aspect, and also, to a large degree, a financial aspect. And so having that well-rounded care team, and many people would look at palliative care and say, well, palliative care is end-of-life care, which is not my viewpoint on it. My viewpoint is palliative care begins at diagnosis with a care team that encompasses all the professionals, not just the oncologist and the surgeon. And what's your feeling about that?
Yeah, I couldn't agree more. So probably the most important thing I can say about palliative care is that it's misunderstood. So there are many different kind of definitions, and it's a young field that's evolved a lot recently, which is probably part of why we're not all on the same page about it. But palliative care is specialized care for people facing a serious illness. That's the definition that I prefer, and I like it because it's independent of prognosis. So you can be getting a curative intent treatment, which we're often giving to patients with AML, for example, but it doesn't mean you can't get palliative care. And what it can do for you in that setting is basically to provide an extra layer of support. So one thing we recently did, my colleague Dr. El-Jawari at the Mass General Hospital has completed a randomized trial actually that was just published in JAMA a couple weeks ago of early concurrent palliative care during stem cell transplant. And basically what she found in this work is that patients have dramatically better symptom experiences, quality of life, and less issues with anxiety and depression when they're going through a curative intent transplant than those who didn't have that extra layer of support from palliative care. So we're trying to apply the same principle to AML patients getting chemotherapy in the hospital, which often is with curative intent, and we're going to be starting a new study in that realm too, to see if adding this extra layer of support can yield those same kinds of benefits for our non-transplant AML patients. But it's just one example of what now is a pretty large and overwhelming and growing group of data that show that palliative care really helps patients and helps families and caregivers dramatically when you're facing a difficult, serious illness like cancer.
Yeah. Well, doctor, thank you so much for stopping by. Fascinating work, fascinating study. I'm going to be very anxious to keep up with it and see where it goes. And I think you're right. Palliative care is such a new area, probably, as you point out, leading to why there's so many opinions on what it is. But I think with your work and the work of your institution, we're heading in the right direction. So thanks again for stopping by, and I wish you all the best.
It's great talking with you.
Thank you.
Appreciate it.